Hi, I'm Anyo Suico and with me is Doctora Asuncion Fernandez. Doctora Fernandez is an active consultant in St. Luke's Medical Center, Quezon City's Advanced Reproductive Care Unit, and Global City Center for Advanced Reproductive Medicine and Infertility. She is also presently Assistant Professor and Interns Coordinator at the Department of Obstetrics and Gynecology in St. Luke's College of Medicine, William H. Quasham Memorial. On top of that, she is also the training officer of the Clinical Fellowship Program in Reproductive Endocrinology and Infertility in St. Luke's Medical Center, Quezon City. Dr. Fernandez, thank you for joining us.
Thank you. Thank you for asking me to join.
Let's dive right into the first question. Okay, so our first question for today is, are faith and treatment compatible? Have you had patients that come to you asking about that?
Well, first of all, I would say that we should not separate faith and treatment, because even in the Bible, in James 5, 13 and 14 to 15, it says that is any one of you sick? So you have to pray. Is any one of you happy? Then rejoice or be happy. But in the olden times, it was told that if you are sick, you go to the elders and um, for them to apply oil and for them to pray for you. So in the modern days, if we would associate that with what is recent, the oil can actually be a different form of treatment or maybe a diagnostic test which you need to go through so that you would be able to know why you are sick, and then after knowing all this, you can go to your elders and have them pray for you.
I see.
So I know that we remember that even in the Bible we had pregnancies even in an older woman. Mary even Jesus was conceived by a virgin. So if it is the Lord's will, and if it would be part of His plan, then one is designed or designated to become pregnant. We've actually seen patients who seem to have normal results and yet they don't get pregnant right away. But we've seen miracles upon miracles which show the possibilities of someone above there doing great things to show that even science cannot actually give an answer. So faith should be together with treatment. Even doctors were given wisdom to to treat our patients, and if these patients would just come to us and we could guide them or lead them to their problems and for us to be able to solve that, then with or without our help, God would answer their concerns.
So we keep an open mind, but we always keep that within the context of our faith.
Yes.
Yes, great. Thank you so much for that, Doctora. Now, we have a lot of questions that came in through the Facebook page, Baby Goals, and we would like to give you one of those questions, if that's all right, and we'll explain what the question was. So, the question came in, and it is, we were trying to conceive for almost 6 years, but nothing happened. Based on my husband's sperm lab, mahina sperm count niya. Tapos, yung sa akin naman po, parang walang progesterone. What to do po?
Okay. So the first thing we need to consider is that when we talk about infertility, the patient is not just the male or the female. So it is the couple. So we need to look into all those considerations, like is the is the female of an advanced age? Is she ovulating regularly, or does she have fallopian tubes that are open or blocked? And also, we need to consider if the husband's sperm parameters are normal. So, if she says that the husband's count is mahina, so ibig sabihin po nun, maraming parameters, pero tatlo yung major na concern doon. Yung bang concentration, mababa. Ito yung dami ng similia per ejaculate. Okay? Pangalawa, ito ba yung mababa ang motility? Kasi the sperm should not only be able to move, but it should have a forward progression. And yung thirdly, yung normal forms. So, yung normal forms, gaano karami ba yung percentage ng abnormal at saka yung normal? The WHO um, manual for normal results, or at least yung reference values niya, would actually have certain numbers. And we tell our patients their status depending on those parameters. But of course, we have to take the whole picture. Consider, kasi minsan mababa ang normal forms, pero marami naman yung count. So, depende
There are
dun
many
sa,
factors to consider.
as a result, then we manage whether we could still consider a natural process, or maybe consider intrauterine insemination, or go forward and move to in vitro fertilization. So going back to the wife who said that she had low progesterone, we have several factors. Ibig sabihin ba nun, parang mas marami ang estrogen niya na hindi kayang habulin ng progesterone, kaya hindi regular ang pag-menstruate niya. Or second, talaga bang kulang yung support. We have this condition which we call luteal phase defect, na umiikli yung yung second half of her cycle because of the progesterone deficiency.
I see. And that also becomes a very important factor if they're trying to conceive.
Yes.
So what should they do next? I mean, knowing these factors, what would you recommend?
Well, I mentioned that we need to find out which one is actually the cause. So for the male partner, we need to see if his numbers are okay for either a natural or an assisted reproductive procedure, or maybe just an artificial insemination. But for the wife, she needs. We need to find out if we can give support to extend the luteal phase so that she's able to complete her waiting, or her ability to get pregnant.